U.S. flu report predicts chaos. Outbreak could devastate young. And of course, the CBS special, Fatal Contact, Bird Flu in America. Wow. Hi, I'm Dr. Dan Daugherty, the Health Commissioner of Ashland County-City Health Department. All of this information about pandemic flu can really be devastating and exasperating and frightening. The employees of the Ashland County-City Health Department would like you to know that we have a plan should pandemic flu affect our community. We have produced this DVD so that you might know what our plan will be and what your responsibilities might be should pandemic flu occur. Pandemic flu is the term given to an outbreak of a new influenza virus that can be spread from person to person and will result in serious illness and numerous deaths worldwide. Past examples of pandemic flu epidemics would be the Spanish flu of 1918 that killed over 50 million people, the Asian flu of 1956, and the Hong Kong flu of 1968, although the latter two were not as deadly. Each of these flu outbreaks originated from a new strain or mutated flu virus that spread extensively because the present population did not have immunity to fight the new flu virus. The World Health Organization and the Center for Disease Control are constantly monitoring illness, including flu outbreaks throughout the world. Of great interest right now is the bird flu that originated in Asia in 1997 and has spread through bird populations across Asia to Europe. This virus, although it is an influenza A family virus, cannot be averted by any of the present flu vaccines that we have. It is found chiefly in birds and has been known to affect humans. About 100 deaths have occurred in Asia from this virus, but as of yet, none of these infections have been spread from human to human. All have been caused by human exposure to sick or dead birds. One fear of the CDC is that should this virus mutate or change its character, it might change into a form that could be spread from human to human and that could possibly initiate an epidemic that would be worldwide or pandemic. Should that occur and pandemic flu reach our community, critical information would be announced from any of the following sources: the Ashland Times-Gazette, the Loudonville Times-Shopper, WNCO, WRDL, WMAN, WYHT, WVNO, WRGM, Armstrong Cable TV, TV2 of Ashland University, WMFD or Channel 68, and of course the Ashland County-City Health Department website that can be found at www.ashlandhealth.com. Should pandemic flu threaten Ashland County, you may be instructed to report to a POD, or point of dispensing, where, if available, you can receive an immunization or medication that will protect you against the pandemic flu. The two sites that we have chosen as possible POD sites are the Loudonville-Perrysville High School and the Ashland County Fairgrounds. If requested that you report to either of these POD sites, these are the instructions that you should follow. First of all, you should only report to the POD site if you are not sick. Anyone experiencing symptoms that could be indicative of a pandemic flu virus infection will be turned away and sent home. All persons who are ill should quarantine themselves to their own homes for at least 7 days, which is the critical infectious period when they are of danger to the community. Or they should report to their healthcare provider or a hospital. Also, anyone who has been exposed to those who are ill with the flu symptoms should isolate themselves for at least 3 days, whether they are experiencing the symptoms of flu or not. The first stop at the POD site will be for triage or screening. At this stop, you will be asked some questions about your health and any recent exposure to sick persons and perhaps have your temperature taken. Also at this stop, you will be told whether to report to the fast-track, special needs, or pediatric lines when you get to the final stop or the medication vaccine administration. The second stop will be intake or registration. Here you will furnish information regarding your name, address, phone, and health history. If you have a valid driver's license or ID card, you may run that under the swiper scanning device that will read the barcode on your ID and automatically print out most of your personal information. The third stop will be a waiting area where you may watch this DVD again with updated information about the virus that is causing the pandemic flu and what treatment you will be receiving at the Medication Vaccine Administration stop. Here you should also have the opportunity to read information sheets and sign a consent form to receive treatment. The final stop will be the Medication Vaccination Administration area. This is the place where you will receive a vaccination or medication that should protect you from the pandemic flu. There will be several lines at this stop, and you will already have been instructed as to what line you should report. One line will be designated for pediatrics, children at an age or weight that the medication or vaccine might need to be adjusted from the standard adult dose. Another line would be for special needs individuals. This would include individuals with chronic illness that might be affected with the medication vaccine that is being administered. These people may need consultation with a physician or a pharmacist as to whether any medications might interact with the medication vaccine to be given. The other line or lines will be designated fast-track, and this will be for the majority of the individuals reporting to the POD site. These individuals have no contraindications for the medication vaccine and can be processed quickly and efficiently.
What can you do now to prepare for the pandemic flu? If the pandemic flu hits our community, it is estimated that up to 40% of the workforce would be affected, closing grocery stores and drugstores. In that case, it would be wise to stock up on Tylenol or ibuprofen, as well as some medicines for diarrhea and supplemental vitamins. Have a supply of bottled water on hand and a good thermometer. A small supply of canned or frozen food that could feed your household for about 2 weeks would also be in order. Dried cereal, granola, protein or fruit bars, crackers, and several cans of canned meats, fish, fruits, vegetables, or soups would be advisable. Always keep a list of emergency phone numbers in a location where all family members can find them, with the numbers of your health care providers, the local hospital, and emergency care providers. A family health history information sheet would also be great to have on hand. We don't want you to panic about the pandemic flu, but we do want you to be informed and prepared to the best of your ability. Of course, we can't predict if or when the pandemic flu will come to our community, or even if there will be a vaccine or medication available. But we at the Ashland County-City Health Department want to be available to help you in any way that we can and to answer any of your questions. Thank you for watching this DVD.